So now coming to the placement part, like here in India, when you do masters, especially the management
Mhm.
courses, every college here will provide some form of campus placement support, right?
Mhm.
So is this the same in United States?
That's a good question. So I think I can't say yes immediately, but there are some schools that let you that require you to do a summer internship. So the program is basically divided into 4 semesters, at least mine was. And between all of these, you get a summer, which is 3 months. So
Mm,
some programs will put you in an internship somewhere. It could be in a hospital, it could be in a public health organization, it could be in like any place. You gain some experience and you'll make connections, right? You'll have a boss, you'll have managers, you'll have other people. So majority of the time, what happens is the place you go in for an internship, you build connections and you prove yourself, right? Like you show your work, and then they might actually end up offering you a long-term job. But this is not a very common phenomenon. It does happen. It does happen to a lot of students. But I'm not saying 100% of the times, oh, I got an internship. That automatically doesn't mean I have a job at the end of my masters. So that is the first thing. And the second way to go about it is the school, the program you are in, it connects you with a lot of alumni. So people who have gone through that path, your seniors, and people who have graduated maybe like say 3 or 4 years before you. You have all these connections. So
mm,
you reach out to them, you talk to them. There are some networking events that happen. So your alumni comes to the school, they talk about their job, they talk about where they're working, the company or the hospital systems, etc. And then you can then make that connection. Again, it's all driven by being proactive. Nobody is going to come to you and say, okay, now you're done with your masters, let me take you and put you here in a job. So that is not going to happen. You really have to be proactive, find, and even when you reach out to your seniors, right, they'll ask you, what do you want to do? It's not like I have a job, come work for me. That is not going to happen. They'll ask you, let's say there is some hospital, right? Let's say Mayo Clinic. Mayo Clinic is a hospital. So if you want a job at Mayo Clinic, just reaching out to somebody at Mayo Clinic is not going to work. You have to go to their job portal, find a job, look at what you want. And if you see an opening and if you have a senior who's working there, you can kind of connect with them and say, hey, I came across this, I want to talk more. So it's all about you and how you want to build yourself and all of there's always help. You can reach out to your program directors, you can reach out to your professors, you can reach out to your seniors. They'll connect you leaps and bounds. Yeah, they'll connect you to so many people. End of the day, what is going to happen is again very much dependent on how you're approaching the situation.
correct. I think that's fairly put. So, but here in India, like we know, we do have campus placements, sort of,
Hmm.
facility that is being provided by the management schools.
Yeah,
So, as Dr. Indrani correctly mentioned, for all the audience, be proactive because that is what is going to help you. Make sure that you have good communication skills and work on your soft skills. That's the utmost thing, which is, starting from the application till the end, till you don't get a good opportunity. This is what is going to definitely help you. So, moving ahead, I just wanted to know, like you said, network building is one way of getting placements. Are there also any job portals or any other areas? Like, do they also host some, career fairs kind of, services or facilities, basically? Is that also
yeah, that is, yes, most universities do offer career fairs.
okay?
But I think in the healthcare setting, I guess, yeah, again, at the same time, healthcare does everything differently.
Yes.
So you do have some career fairs that happen. All the majority of the hospitals, they kind of post online job events that you could attend and see what they have going on. Um, at any point of time, once you start looking for jobs, when you're close to your time of graduating from your master's program, look up where do you want to work, right? Like, for example, I don't have any geographical preference, so I can look anywhere in the United States. But there might be somebody else who might be, they might have family, they might be married, whatnot. So they might have a geographical limitation, right? If I want to find a job, let's say in California, then your list of hospitals will go down. And within that, again, what kind of job do you want? Again, you need to filter that out. And on the same time, if you have just gotten an MHA and if you only have 1 year of professional training period, then you would have to find a job that would also offer you like a work visa situation that they'll be able to sponsor you the work visa. So there are so many different facets to it. Again, rely on trusted sources. There are a lot of consultancies you could go through even here, like the job consultancies. Again, the challenge is that they might put you in some sort of well, there's a broad spectrum of jobs for sure, but the consultancies I don't think have evolved to a point where um, healthcare has become like the forefront. The forefront is still IT, and there are certain, of course, there are certain consultancies that can work with the health systems. There's Blue Cross, Blue Shield is one such organization that has third-party employers. So you can go through that third-party employer, and they'll take care of all the technicalities, and you could work for like big organizations like that. So
Correct.
yeah, there are certain platforms that'll help you land a job within healthcare as well.
Okay, okay. That's fair enough. And what are the various sectors or various opportunities that one can explore after they complete MHA?
Oh, it's unending. It's a long list. It depends on what sparks your interest in your masters as well. So there is healthcare finance. You can be working as a financial analyst in a hospital or finance coordinator, and you can look at finance part of it. There's also the administration itself, right? You could be a project manager, you can be a program manager, you can be a department manager. Let's say like let's take Apollo hospitals or some big hospitals in India. There's dermatology, there is pulmonology, there's so many different departments in that, right? And each department, at least in the United States, has an administrator, a manager, positions like that. So you could easily do something like that. There's also business intelligence. A lot of health systems here, they rely on a lot of digital products. There's a lot of digital tools, so you can work on that. If you're somebody who's interested in the tech kind of stuff and leaning more towards informatics, you could also become like a BI analyst or BI. You can even write scripts or build tools, and you can work on such elements. There's also like quality and performance on one side. There is risk and emergency on the other side. So I'd say there's a lot of like, diverse portfolios that are open out there that you can pick and choose from. Again, trying to see where you would best fit, and yeah, going from there, finding an opportunity. So there's a lot of things that you can do for sure.
Correct. So now, if from say US, I move back to India, I'm sure there would be opportunities because here again, MHA is again a good field, after BDS or anyone who
Yeah.
wants to pursue it. But
Hmm.
say if I from US, if I want to move to some other country, is the
Hmm.
how are the opportunities, or have you seen this kind of move happening in within your batchmates?
Personally, I haven't seen any of my friends moving that way, like from India to a different country. I mean, from the United States to a different country. I did see a lot of them moving from India to here, even after MDS, or to Canada or something like that. But I would say, once you get a degree from United States, it's pretty much well valued across the world, I feel. So for MHA, I'm sure if you have some experience at least, right? Again, I think you might have to go through, like, for example, let's take a use case scenario, right? If I am here and if I have to move to Europe, find a
Hmm.
job, I might have to go through certain credentialing process for dentistry itself, right? However, with the masters, I would still have to, just for the visa process, I'd have to do the whole credentialing. What have I studied? What have I done? And all that. So through that credentialing process itself, you might be able to understand, where do I fit? Do I have a career there or not? I'm sure there's more like, management, administrative, and IT and finance kind of jobs across the world, and there is a lot of demand for that as well. Even in the Middle East side of the world, right? Even on that side, there is good demand. It just depends. I mean, you really need to look at the guidelines of each of these countries. What are they accepting? What do they not accept? But I feel if you bag some experience, at least like, after your masters, if you can gain, let's say about 2 to 3 years of experience here, I'm sure you'd be able to land a job in a different country as well. Even in India, right? Even now, India's health system and healthcare sector is also growing so much. Like there is a good need for all these new advancements and all these different aspects that would fit well in Indian market as well. So
Correct.
I'd say, yeah, it would be a good. You just have to kind of like make your own path. You have to make your own path. You have to be able to comfort. You have to be comfortable with it. But I'm sure there's opportunities. It's not that you'll have to start from scratch. I
Yes,
think it's not that.
yes,
Yeah.
absolutely. Yeah. And what's the biggest advantage that you have gained, over the years working in this area?
I would say the breadth of experience. I all my life I have always wanted to be somebody who is practicing clinically. I always wanted to be a clinical practitioner. I wanted to get into medical school. That didn't happen. Dental school happened. It was great. But that was, it's like the toad in a well, right? Like, you only know your world. You only know what you're exposed to. So, but then when I moved here, there's like a million things you can do in healthcare. As a clinician, you might be impacting a few hundreds of lives, and which is great. I mean, you are changing lives, you're helping people get healthier, you're literally saving patients. It's next to God, is what we believe in India, right? So, but with initially, it was hard for me to go through this transition of being a clinician to, being something else. But there is a scope where, in public health or other areas, you are affecting the community as a whole. You're affecting the health of a community as a whole. And it is a big deal. A lot, more than oftentimes, I've heard a lot of my other friends say stuff like, I miss being next to the chair. I miss, doing clinical work. I sometimes miss that too, because that is my, like, first identity, right? That was my first identity. But just realizing the fact that the scope of work you do affects your community at large, that you're driving health as a whole in your community. I think that has been my biggest um, lesson I have learned, and that is the biggest experience I have gained. And I'm really happy that I had taken this direction and have learned that there is so much more to healthcare than just addressing a chief complaint that a patient has come in with, versus there is so much more in the background to it. There is like prevention, there is mitigation, there's you can work on so many things across healthcare.
Correct.
So if anybody is still kind of going through that identity crisis of, I don't know if I want to do this, I don't know, I might want to do something else after BDS, I would strongly suggest for people to at least come explore what is happening within healthcare in the other parts of the world. And then maybe that might spark some new interest in you. You might get entrepreneurial, or you might even find things that you can go do in India, and kind of like have that kickstart in India, where you're going forward than what is currently happening there, or technology wise and whatnot.
Yes.
I
Correct.
remember I remember being in my internship and writing, paper charts, right? We do that on the paper charts. And after I came here, I was like, oh my God, there is so much more to this. Everything is happening on a computer screen. I can't imagine, like, and it's amazing too. Like, I go to a doctor, get some screens done, and they show up on my computer by the time I come home, and like an X-ray or whatnot. There are advantages and disadvantages of both the cultures, but just learning that something else exists out there will be a great experience for anybody to uh, shape their life and career.
Correct. Correct.
Yeah.
Absolutely. So, it's been a really, really good and very inspiring, very what do you call, very structured conversation that I've had with you. Putting down all these points which are very important for the applicants who want to pursue MHA in the United States. So, thank you very much, Dr. Indrani. Any last
Mm.
thoughts, advice, or tip for the audience?
No, likewise. I mean, you've come up with such amazing questions, and these are all the questions all candidates have to really, internalize and think about when before they make this, big decision of, moving from one country to the other and pursuing something entirely different after 7 years of professional training in a white collar job. So it's not easy. So thank you first of all for all these questions, and even doing whatever you're doing. This is great. This is great work. Tips would be, I think, if I had to really summarize all the things we've talked about in the last 1 hour, is that do your groundwork.
Mm,
Do your groundwork, rely on good source of truth. Don't go with what a consultancy is saying. Don't go with what the trend is. Don't go by, like, 10 people have gone for MHA. I've really heard this last year from somebody saying that, oh, everybody is going to the United States. We should go there too. So that's not how it works. I would really suggest like do your groundwork, know why you're doing it, have a why, what is your purpose. I think after BDS, as you have suggested, that is the greatest opportunity you can have at life again, where you're trying to choose what you want to be, what you want to do. Now it is in your hands and you can shape it the way you want. So, really focus on that, find your purpose, understand what will bring you satisfaction and happiness in life. And go in that direction. Don't go by the trend. The trend is overrated. so so yeah, I guess that is my biggest advice for anybody who's gonna go down this route.
Yes. Thank you
Yeah.
very much, Dr. Indrani, for once again coming on our platform. And thank you for all the encouragement that you have given to us. Thank you so much.
I'm happy to be here, happy to help any way that I can to my dental fraternity. Yeah, I miss being there. So, yeah, I'm happy to help any way I can, Dr. Saini. Thank you so much for this opportunity.
Thank you. Thank you. So, all you audience, I hope you got all the answers to your questions because these are some basic questions that everyone would be having if you want to pursue MHA in the United States. So, thank you everyone for patiently listening to us today. If you have any other questions, you can always reach out to us, or I will also link down Dr. Idrani's LinkedIn profile. If you want to connect back to her, you can always do that. So, thank you so much once again. And before I sign off, as I always say, please subscribe to the channel. It's absolutely free. Like and share this in your network because this might help out someone who's looking to pursue MHA in the United States. Thank you so much, everyone. Once again, I will see you in the next video. Until then, bye and good luck.